today is the 16th June, Monday, and we are going to theory part of view this vesicovaginal fistula. See, in my dear Dr. Nadia, please can you close your mic? So in that one, what we have to know, the thing is important thing which he is telling. The first important thing, what is vesicovaginal fistula? There are many type of fistulas. Okay. First one, we have to know what is vesicovaginal fistula. Vesico means what? Vesico means bladder. Okay, bladder. It is a fistula between. Means fistula means there is a small opening. There is an opening between the bladder and the vagina. Did you see the picture here in front of you? This is the bladder. Okay, in front of the uterus is the bladder and back is the rectum. Okay, so in front of the this one, so what, see here there is a point here. This point means this is the bladder, and on the back side this is the vagina, and this on the upper stair is the cervix. So it is opening in the vagina, so it will call it vesicovaginal fistula. This is the one fistula. Okay, अब ये जो फिस्टुला, एक तो ये भी हो सकता है, एक फिस्टुला ये होगा, और एक होता है ये नीचे अगर हम जाते हैं ना, ये इस साइड पे नीचे की तरफ जा रहे हैं, तो ये फिर एक यूरेथ्रा होता है, एक यूरेथ्रा से लेके फिर विजाइना में चला जाता है, तो यूरेथ्रोविजाइनल फिस्टुला हो जाता है एक। और देखिए डॉक्टर साहब, ये हमारा जो ये ब्लैडर है, ब्लैडर में दो जा रहे हैं, उसके कोने पे दो यूरेटर जाते हैं ना, तो एक यूरेटर को ये हायर अप होता है ना, यूट्रोविजाइनल फिस्टुला होता है, ये विजाइनल में चला जाता है ज़्यादातर, और अगर उसमें नहीं जा रहा है विजाइना से यूरेटर में, यूरेटर को कट करके ये विजाइना में चला जाता है। अगर ये भी नहीं करा है तो डॉक्टर साहब बाज़ दफ़ा क्या होता है कि ये जो होता है ना अंदर ही एब्डोमिनल कैविटी के जितने भी फिस्टुलास हैं ना, अभी तो हम बात करें कि हमें नॉर्मली मिलते हैं जो हमें करने हैं, मगर ये फिस्टुलास क्या करते हैं, प्रॉब्लम क्या करते हैं कि ये जाके रेक्टम को भी कट आउट कर देते हैं। तो ये होता है, या तो ये बन जाता है इसका यूट्रस से लेके रेक्टम में बनेगा, या यूट्रस से लेके रेक्टम ये ब्लैडर में बन जाएगा। ये भी फिस्टुलास होते हैं, मगर ये अनकॉमन होते हैं। जो सबसे कॉमन होता है, जो हमारे गायनी के पॉइंट ऑफ व्यू से हमें है इम्पॉर्टेंट जो है ना, वो वाला, ये वाला इम्पॉर्टेंट है, वेजिकोविजाइनल फिस्टुला। ये एग्ज़ाम का क्वेश्चन है आपका, ठीक है जी। अब वो कह रहा है कि क्या होता है वेजिकोविजाइनल फिस्टुला, क्या होता है। वेजिकोविजाइनल फिस्टुला इज़ एन अबनॉर्मल कनेक्शन ओके बिटवीन द ब्लैडर ओके एंड द विजाइना। सी आपको समझ आ गया ना, इट्स इन फ्रंट ऑफ यू। सो हो गया हमारा ये वाला। अच्छा, अब हम करेंगे, यहाँ से चलते हैं, बात ख़त्म हमारी हो गई। इससे ज़्यादा हमें ज़्यादा पढ़ने की ज़रूरत नहीं है, क्योंकि डॉक्टर साहब आपका थ्योरी का है, आपको उतना ज़्यादा इम्पॉर्टेंट नहीं है। ओके जी, तो फिर क्या होगा कि देयर इज़ अ कनेक्शन देयर, दिस कनेक्शन विल स्टार्ट टू प्रोड्यूस यूरिन, इट इज़ कमिंग फ्रॉम द विजाइना, through the vagina, and instead of urine coming through the urethra, it is coming to the vagina. One thing we have to remember there, here we cannot control our the urine is not controlling, because it is coming in the vagina. If it coming through the vagina, through the urethra, we can control. Okay, it's like a door. The door of the urethra, it can be closed and it can be open. Okay, but here the problem is that it is a vagina, there is no control in the vagina. So if there is a fistula, there is a connection there between them, so it will come continuous. Please remember, this is not for you, it is for the what we call OSCE point of view, OSCE or talks. Okay ji, so this is important for the talks of point of view. They will give you now they will not give you the total diagnose. They will give you the some points, and then they say now you have to diagnose and take the history. Now they become bad also. It is not an easy exam nowadays. Okay, so what happened, we understand this thing, we finish up to this point. Okay, अब ये now the other question he is telling how the fistula is developing. Okay, mostly it is developed after childbirth. If she is having a difficult labor means obstructed labor. Please remember this word. It will develop in the underdeveloped countries after obstructed labor. Okay ji. और उसके the other causes after is that one are the surgery, there can be a radiotherapy, okay, and some they born with fistula. So this is very rare. Okay, this will be the congenital fistula, and these are rare. But the most common one is that in our countries, because they will ask our countries, they will not ask about the white people, European people. They will ask the most common reason for developing the fistula. This is MCQ I'm talking. Is the this is the one, obstructed labor. Okay, there is a big list of these causes. I will share in the group. Right now, it is not here. Okay, so now he is telling what are the how we will diagnose, how we are going to diagnose it. So the first one is the we have to take, if she is telling, patient is complaining that she is draining some white color of like a urine from her vagina, and vagina or anything, she can say that she is passing like this one, and she cannot control. So first thing in your mind, it has to become that if it is not controlling, so after childbirth she is having it, this MCQ, after childbirth she is having a not control of the urine, a continuous passage of the urine. So it is with the obstructed liver. This is gone. So what we are going to do, we are going to send that specimen of the urine, which we have it here, the specimen, we will send it here. Okay, then we have to do the vaginal examination. Before vaginal examination, we have to do the speculum examination. So it will, what test it need? The test is the urine specimen, then the speculum examination. So speculum examination, the most important point we have to tell, this is called the cuff test. Cuff test. We will ask from the patient that please, when we are doing the speculum, we will ask to the patient, please cuff. She will cuff it. You can see yourself the urine is coming out. Okay, because your speculum is in her vagina, so through the vagina the urine is coming out. Okay, so this is one of the vaginal means speculum examination you are going to do it. Okay, so afterwards this is the most important test. This we call it 3 swab test, because we are the poor people. In our poor countries, we are doing this 3 swab test, but outside the world they are not doing this one. They will do the cystoscopy examination under anesthesia, and they can diagnose the case. But we are the one who, how we are going to have it, we have to do the 3 swab tests. So what is this meaning of the 3 swab tests? What they are putting it here, you can see it here. This is the vagina. Okay, this is here the vagina going on. This is the vagina. In this vagina they will put 3 swab. Okay, the cotton swab. Up one, it is going up, high up, the middle one and the lower one. The thing is that after that they will fill the bladder with iodine. Okay, or this is the solution they will put in the bladder. So what they will do, with the 3 swab they will put in the vagina by the speculum, through speculum, na? Without looking they will not. One on the top, one in the middle, and one in the bottom. Okay, please remember this swab test, because you know this is the question, MCQ question is coming. Okay, then they will put a catheter, in the bladder, and they will put the blue dye. Okay, in the bladder they will fill the bladder with blue dye. So what is happening there, and then they will ask to the patient to strand or a cuff, whatever they can make it. So what is happening, that this blue dye will make the swab, the white color, na, cotton swab, they will make the color changes. So if we will start from the down to the up. If it is from the down one, see there, the catheter is removed, and you will ask to walk for half an hour, but not pass the urine. We are not supposed to pass the urine. This time swabs are, then we will remove afterwards. We will remove the swab. Or if the swab is blue, if any of the swab will be blue, it means it is a urine. Okay, urine leak from the bladder into the vagina. This means she is having a fistula. This is confirmed. Okay, now we have to understand what is this 3 swabs are going to do. The high one, see in the top, the middle or the bottom swab is stand. But the third one is standing very less. Please remember that one, because the third one is going to the ureter, and ureterovaginal fistula are less. Okay, Mostly the bladder and the vagina are the connection, and the urethra and the bladder are the connection, but not the ureter. Ureter are the less one. Is clear for you people or not? Hello? Here see.
जी जी
Alright, you understand my
या
friends?
जी
Okay.
जी
So this is the thing you have to understand. So see, the upper one, the last one, it will not going to be stand. Very rare it going to be stand. Okay. So it means the ureter is not involved. You cannot see it in that the third one, because the ureter the swab will be not stand. It will stand to the bladder, to the vagina, because we put the dye in the bladder, not in the ureter. How could we will put it? It will come through the kidney to the ureter. Okay. So we finish our this thing, this three swab test. Okay. The three swab tests we finish. After that, this is the most important test, cystoscopy examination under anesthesia. This is in the developed countries they are doing. So that for you only this is important. Urodynamic is not so much playing part here. Only the part of the urodynamic is here, how much the bladder can hold the urine and how much it can be empty. That's why this is not the one. X-ray, CT scan and MRI, they play the part. Okay, because these are the soft tissues, so we can see with this one. Okay, so the urodynamic is important in the bladder problem, but scan and the MRI, only we can get something here, because these are the soft tissue. Very nice picture will come. So now how we are going to treat it? Okay, now the treatment, the last part is coming. He is telling it what we do. Catheter. Sometimes we have to, if it is early diagnosed, within 24 hour patient is in the hospital. She delivered and she start to have this fistula, and she is in the hospital. If it is discovered, so we will put for her the catheter. Okay, a very small fistula, less than 1 centimeter. So what we are going to do, we have to put the catheter. Why we are putting the catheter? The important question, the exam question is that this catheter we are going to put for 12 weeks, because there is a inflammation, there is a sloughing, it will go off and it will heal if it is a very small one. Remember that word. How many days catheter we are going to put? 12 week. Okay, up to 12, 6 to 12 week, it will put it, we put it. Okay, that's all, because the fistula will heal it by itself. Then another one important one is the surgery. Of surgery, we have to do the repair of the fistula. Through the vaginal, we will do the surgery. We will do the cut in the vagina by laparotomy or by laparoscopy. These are the three methods which we do the repair of the fistula. And after that one, that means if it is more less than 1 centimeter, we will do with laparoscopy. Okay, we don't need laparotomy. If it is a big one, more than 1 centimeter, we will do by laparotomy or through the vagina, because you know what we are going to put it here. We will put as a mesh, like a covering, like a, when there is some cloth, like in your home, one cloth is torn and there is a gap in between both two, so you cannot make the gap to stitch the gap. Sometimes they will stitch the gap, and but if you cannot stitch the gap, so what you are going to put it, you will put a like some tissue. Before they are putting the mesh no more in use, so they will put some tissues area they will take from the body, and they will cover that one. Okay, this is the operation they will do it. And my dear, this is the only thing we do, and I think this is the first, because theory point of view I am talking.